Hi, everyone. Welcome back. We're going to dive right into some of our specific substances that we'll be covering in this lecture. The first of which, a very common one, will be alcohol. So alcohol, the actual chemical or psychoactive component of alcohol is known as ethanol or ethyl alcohol. Psychoactive means it's what changes your mental and physical state. Now, alcohol is interesting because we might think that it just impacts our brain and our mood, but it actually impacts every organ in our body. And it's an interesting drug in that at low doses, it acts as a stimulant, so it can increase our energy and alertness. And at higher doses, it acts as a depressant, so it will decrease our energy and alertness. And as you drink alcohol, it begins to absorb very rapidly. It'll absorb a small amount in your mouth, about 20% in your stomach, and the large portion of that will be absorbed next in your small intestine. So generally speaking, the more food that you have in your stomach, the slower that the alcohol will absorb. So let's talk a little bit about what makes up a standard drink and what moderate or excessive alcohol use actually looks like. So a standard drink differs depending on the type of alcohol. So hard spirits or hard liquors, things like whiskey, gin, vodka, tequila, are going to have more alcohol or a higher alcohol percentage, sometimes referred to as proof. So something with 40% alcohol would be referred to as 80 proof. Then wine will be the kind of moderate amount of alcohol, with beer typically being the lowest alcohol by percentage. So a glass or serving of beer is typically bigger than a single serving of liquor. So for regular beer, 12 fluid ounces. So that's a bit smaller than a pint glass. So you can see the bottle here is considered one serving. For malt liquor, which is kind of like a harder beer, it'll be a slightly smaller serving. So 8 to 9, that would be like a large cup. For wine, 5 ounces, that would be like a half cup or a half glass that you see there. And then for liquor, hard liquor, just 1.5 ounces is considered one drink, which is really just like an inch and a half poured into a cup. So you can see what one standard drink is. So when you think about something like a big mixed drink, like a Long Island iced tea that has many different liquors poured into it, that's going to actually be considered more drinks than just one. Or if you pour 2 shots into a drink, that'll be considered 2 standard drinks as opposed to just one. So we define moderate alcohol use as 1 drink per day for women and 2 drinks per day for men. And this is generally based on the premise that overall, men are often bigger than women in body size. This is just based on body weight. Binge drinking or excessive drinking is defined as 4 or more drinks per day for women or 5 or more drinks per day for men in roughly a 2-hour window or a single sitting. So we'll talk about some of the purported health benefits and risks of alcohol use. An important thing to know here is that the health benefits occur with moderate use. So that's 1 to 2 drinks per day max, spread out through the week, rather than saving up all those drinks and drinking 4 or 5 or more drinks on 1 or 2 days out of the week. That's where we see health detriments start to occur. So let's talk about some other factors related to alcohol. Blood alcohol concentration is a number that represents the percentage of the fluid in your body that's made up of alcohol after you drink it. Interesting when you think of it that way, huh? And you can see a chart here for women and for men that represents body weight and number of drinks that estimates the blood alcohol percentage or concentration of that individual after having a certain number of drinks. So let's say if we look at our woman column, and this is based on sex assigned at birth, let's say someone is 120 pounds, 1 drink would bring them to a 0.04. And you can see where you look at the pink on the right, that at that level, driving skills are actually significantly affected or impaired. So if someone is driving and they're more likely to cause an accident or to be unsafe doing so. So 1 drink for a small woman. And then if you look conversely over at men, let's say a 160-pound man, it takes 2 drinks. And for most weights for men, it takes 2 drinks. And for a good majority of the weights for women, it takes 2 drinks as well. So 1 to 2 drinks is enough to significantly impair driving. That's not the legal limit. The legal limit for driving is a 0.08, at least it is in California. However, know that your driving will be impaired below that. That's why we see when you're driving around the freeway here, you might see on the highway signs, buzzed driving is drunk driving, because it can negatively impact your ability to drive because of its effects on the cerebellum, a specific region of the brain that controls motor function. So you see as you get to 0.08 and above, so that looks like 2 drinks for women, 2 to 4 drinks for women, depending on the size, and 2 to 5 drinks for men, depending on the size. That is enough to put you in that beyond the legal limit. And there are, of course, lots of options now for avoiding drinking and driving. You can take a taxi cab, you can call a friend, you can get an Uber or a Lyft, you can walk, plan ahead of time. That's the best advice that I have for avoiding drinking and driving. Don't assume that you'll be safe to drive later. If you know you're going to be in a situation where you're going to be drinking multiple drinks, plan ahead of time for a designated driver or to be able to order a Lyft or an Uber. And then we see that as we get down to even higher levels of alcohol consumption, 6 or more drinks for women and 8 or more drinks for men in that hour to 2 hour period is enough to lead to health complications that could lead to death. And we'll look more at that in a minute. So it really is important to be mindful of the amount of alcohol that we're consuming. So let's look at some of these immediate or short-term health consequences of alcohol consumption. And you can see in our little chart on the left here, this is based on blood alcohol concentration gradually increasing from 0.02, so that's probably 1 drink, maybe even 0.03 to 0.06 might be 1 drink, all the way to 0.50, which is probably 5, 6, 7, or 8 drinks in an hour or 2 window, depending on your size. So let's see some of the things that can happen. Well, we immediately see slowed reactions. That's why even 1 drink is enough to impair driving. Lowered inhibitions, meaning that you'll be more likely to do things that you wouldn't if you were sober, and lightheadedness. You might have feelings of warmth, loss of inhibition. So again, you're going to do even wilder things than you would when sober, and mild euphoria or happiness. This is what people are typically looking for when consuming alcohol. As you increase, again, 0.6 to 0.10, this could be 2, 3, 4 drinks, depending on the person's size. You might see slurred speech, poor judgment, balance gets worse, again, because it affects the cerebellum. So this is definitely a point at which someone would not be able to drive. Beyond that, you'll start to see some detriments to health. So loss of coordination or function, impaired motor skills. So someone may not be able to walk in a straight line. That's why you'll often see that as a test that police officers use when assessing for drunk driving. Extreme behavior, possible nausea or vomiting. Beyond that is when you really start to see concerns. People can't stand on their own. They may not feel pain. The gag reflex becomes impaired, which is really dangerous to health. If someone ends up throwing up and they don't have an appropriate gag reflex, or they can't swallow appropriately, that can be dangerous to health. And blacking out, where someone doesn't remember or doesn't have conscious memory of an event. Beyond this is where real threats to life can occur. So if you see signs or symptoms like difficulty staying awake, someone's breath seems shallow, their pulse seems low, or their body temperature is low, you absolutely want to seek medical attention for you or the person that you're with. This can lead to, if the blood alcohol concentration is higher, if medical attention is not sought, coma, nerve centers shut down, which means that your heart, your breathing may stop, which can, of course, lead to death. And there's a video for you to click here when you check out the PowerPoint that talks about a real life example of this in a healthy young male college student who was just having fun with friends, ended up drinking too much. People just thought he needed to sleep it off, and he died. That also happened to a student while I was in college. Many of you have probably known people who that's happened to, who similar situation, was drinking with friends. They just thought he needed to take a rest, left him in a room, and he died. So we'll talk about more of the signs and symptoms that you want to be on the lookout for in just a minute. Some other health consequences, let's look about as it relates to driving. 28%, nearly a third of all traffic-related deaths in the US are caused by drunk driving. And it's not always or even often the person that is drunk driving who is killed. It's often the person or people that they hit. And you can see this chart on the right that as the blood alcohol concentration percentage goes up, so too does the risk of getting in a car accident dramatically. That's an over 2,000% increased risk at a blood alcohol percentage of 0.20. Again, I mentioned the legal limit is 0.08, but it's impaired at 0.05, which is just 1 to 2 drinks. We also see health consequences increase because of increased rates of violence, sexual abuse, and assault with increased alcohol consumption. So let's look at some of the possible signs and symptoms of alcohol poisoning, which can result in alcohol-related death. So alcohol and poisoning involves blood alcohol concentration that's so high that your brain centers start to shut down. These centers control breathing, heart rate, and temperature control. So some of the signs and symptoms involve breathing, heart rate, and temperature. Now, your risk varies depending on a lot of things. So, of course, the amount of alcohol that you've drinking, your biological sex. So females are more likely to experience alcohol poisoning than males. Body weight, the lighter that you are, the greater percentage of your body the alcohol will take up, the more you'll be impacted. Whether you have food or not in your stomach. Having food in your stomach will slow down the rate of absorption of alcohol. The speed of drinking. So we used to have a former police detective who would come to our class when I taught it live, who would talk about sexual abuse and alcohol, who mentioned that the most dangerous situation that you can get in is when you show up to a party late and you're trying to catch up with your friends. So drinking fast allows that alcohol to hit you before you start to realize that you're becoming impaired. Carbonation, so drinking carbonated beverages can increase the speed of absorption. And then alcohol interacts with medications and other substances that you'll read about this week. So sleeping pills, antidepressants are a huge one that can increase the impacts of alcohol in your system. Antibiotics, alcohol and antibiotics can actually make you quite sick. And alcohol and painkillers will increase the danger or the risk of experiencing coma or death from alcohol. Now, there are no tricks that work to reduce blood alcohol concentration. Not taking a cold shower, not eating a piece of bread, going for a jog, or anything else. If you experience any of the signs and symptoms, or you see someone who is that we're about to cover, call 911 or take them to the nearest emergency room. It can save their life. So some of these signs and symptoms are extreme mental confusion. If they can't stay conscious or stay awake, if they're just so out of it, absolutely call 911. Vomiting, seizures, slower breathing, fewer than 8 breaths per minute, or irregular breathing, so a breathing pattern that changes. If heart rate feels very slow, and you can always gently check in their neck or the inside of their wrist. Clammy, cold skin, dulled responses, and then low body temperatures or bluish color or paleness. If you notice any or multiple of these things, it's absolutely imperative that you get this person to medical attention now. I know often people are worried about getting in trouble, especially if drinking underage. Those consequences are so light in comparison to the potentially severe and life-threatening consequences from alcohol overdose. You'll read more about this week. Now let's look at some of the long-term health consequences of excessive alcohol consumption. And that's more than our daily moderate drink of 1 per day for women and 2 per day for men. So we see that it can worsen mental health outcomes. So depression and anxiety will be worsened from excessive drinking. It can negatively impact our nervous system. So memory loss, poor sleep. As you read in our sleep section, alcohol before bed actually worsens sleep, even though it feels like it helps. It can increase the risk of stroke, cardiovascular disease, and high blood pressure. It can increase the risk of all kinds of cancers, like pancreatic cancer, stomach cancer, throat cancer. It can negatively impact sexual function, so causing a lowered sex drive, impotence, or reduced fertility for both men and women. It can lead to thinning or brittle bones and weaker muscles, increase the amount of fat potentially because there are calories in alcohol, and they can potentially, being under the influence can potentially make you eat more calories as well. It negatively impacts your immune system. Of course, your liver health, which is responsible for filtering out toxins in your body. So it can lead to liver disease, cancer, or cirrhosis, which is scarring of the liver. Another cancer that it can increase is breast cancer. It can contribute to lung infections, throat or mouth cancer, and then worsening any other chronic conditions in the body, and of course, resulting to immediate or early death from excessive consumption. So of course, alcohol seems really regular and benign, but excessive consumption does have negative health consequences. Lastly, We've talked about some of the consequences, some of the drawbacks of excessive consumption. Are there any benefits? Are there any potential benefits to consuming alcohol? You've probably heard that alcohol reduces your risk of heart disease, and you should have a glass of wine a day. There is correlational data to suggest that one drink per day is associated with a lower risk of cardiovascular disease. And they're not sure why this is. One theory is that it's the polyphenols, which are compounds in wine that are anti-inflammatory. Another is that moderate drinking can reduce stress, and chronic stress is bad for us. So if one drink lowers your stress levels a bit, that can be beneficial for your health. However, we have to remember that the health effects go away, and they're even reversed when we get past that point of moderate drinking. The last key to know is that if you don't drink, physicians say don't start just to improve your health. There's lots of things that you can do to improve your health, such as connecting with others, getting strong social support, finding meaning and purpose in the work that you do, moving your body regularly, eating nutritious foods that are as close to the way that they're found in nature as possible, getting sufficient sleep. Having a glass of wine each day per week or a couple times per week might help, but it's not something you have to feel like you need to add in just to improve your health. So that's our overview on alcohol, what it is, its potential health consequences and benefits. And you'll read even more this week about alcohol overdose, mixing substances, and alcohol use. Join us soon for additional substances as we dive in.